So my name is Judy Nguyen. I am a patient navigator program coordinator at Asian Health Services, and I was born and raised in Oakland. Part of my job as a patient navigator is really to enable individuals and their families to get access to quality medical and mental health services so that they can really be able to experience life without worrying that they don't have this type of coverage or that their family is left uninsured. It doesn't matter about their immigration status or their socioeconomic status. We help these individuals get that access. So my mother arrived here in 1980, so she actually arrived here in Oakland from Malaysia refugee camp where she was residing for about 18 months. The doctors really told her that she only had 10 days to live unless she underwent or undergo emergency medical surgery. She decided to go ahead with the emergency medical surgery, and that actually presented, a life of, an extended life of 14 years, really. That access to those services really saved her life, and, I wouldn't be here today if she didn't make that decision. And Medi-Cal was really the access for her to get the surgery without worrying about medical debt, without worrying about other factors that come along with being uninsured. I was born 7 years after the surgery, and just growing up with a mother that was so charismatic, that was such a warm person. Okay, time out. I'm sorry. Her strength is really what drove me and my brother to be who we are today. I also have to give credit to my father as well. Getting raised in a single-parent household. After that, people should have access to health care despite their immigration status, despite their socioeconomic status. Any legislation that really exempts new legal immigrants from accessing low-income public programs like Medi-Cal shouldn't be passed at all. Health equity is what I focus on, and it's important because there's so many disparities that health disparities within our communities that we should be aware of. With new legal immigrants coming over as well, I mean, this is an introduction to an entirely new healthcare system. So to get that access, that's what I want to focus on. Just to have affordable access to healthcare everyone should have that. And if it's a matter of providing adequate access to healthcare through programs like Medi-Cal, so that everyone really gets that health equity, then I support any legislation that does allow these access programs to exist.